Serving patients through telemedicine is still a growing model in Texas. KXAN's Steffi Lee breaks down how some new laws that passed would benefit patients who don't have access right now.
We passed several pieces of legislation that will really transform rural health care and protect it.
Muleshoe, Texas is a town of just over 5,000 people. Muleshoe Area Medical Center is their level 4 trauma facility, which is required by law to have a physician on standby or able to respond within half an hour. One of the bills signed by Governor Greg Abbott allows them to maintain this designation requirement through telemedicine services.
So we still have that hands-on, face-to-face, and so it's an addition to and not a replacement of.
CEO Dennis Fleenor says they've partnered with University Medical Center in Lubbock to provide this service over the last 2 years, and it works. He points to a time a farmer dislocated his shoulder.
We are able to access orthopedic surgeon, level 1 trauma center orthopedic surgeon via telemedicine. They can walk our providers through that process. And then we can actually set the shoulder here.
He feels without this type of coordination,
bottom line, people would die.
I think that telemedicine is something that will continue to evolve and improve over time.
Another bill awaiting the governor's signature would require Medicaid to cover telemedicine services.
I think that telemedicine won't just be a way to bridge gaps in geography like we're using it today, but it will be a way to provide more comprehensive services to patients in their homes.
Steffi Lee, KXAN News.
The governor has until June 16th to sign or veto legislation. If he doesn't do either of those things, the bill goes into effect immediately. Another telemedicine bill waiting on the governor's signature would make it easier for victims of sexual assault to get justice. Some Texas communities don't have a sexual assault nurse examiner or easy access to one. Lawmakers say that means some survivors in those areas have to choose between getting care from emergency room staff, driving to the nearest sexual assault nurse examiner, or not having evidence collected. Senate Bill 71 would create a statewide telehealth center for sexual assault forensic medical examination. Coming up at 6, how a shortage in prescription pads could affect how long it takes for you to get your medicine.